Dental implants can cost anywhere from $3,500 to over $150,000. Why the massive difference? Today I'm going to explain that to you, why dental implants cost what they do, and what goes into that cost. Dental implants are not just a single product. Dental implant is really a tool that a dentist uses to reconstruct a mouth. That reconstruction can vary from a single tooth to a full mouth. And that mouth might need lots of things. And so while it's easy to say, oh, the dental implant costs this much, in reality, there's a lot of things going on there. There's bone, there's the dental implant, there's soft tissues, there's aesthetics, there's ceramics, there's structure, there's function, there's biology. There's so many things that go into a dental implant. Sometimes that is really simple. A patient has all the bone in the world, all the gums in the world, the structure is easy, the function is easy, the biology is there, and so a dental implant may cost not very much. In other cases, there's a lot of reconstruction that needs to happen. A patient might think, or a doctor might think, oh, the dental implant costs this much. In reality, where the cost comes in is, again, aesthetics, structure, function, biology, how many implants, where are they going? Do we have enough bone? Do we need to do bone grafting? So many different layers that can go onto this to really give you the solution that you're looking for. So that solution really depends on what you want. Do you want beautiful, perfect teeth? Or are you really looking for, the cheapest possible option that will give you something that's better than a denture? And this is why dental implant costs vary so dramatically. So another thing that comes into dental implant cost is the implant quality. An implant is a tool. It's a tool in the toolbox that a doctor will use to reconstruct a mouth, but the quality of that implant varies dramatically. There are companies out there that have been in business for 30 years that have lots of data, that have published research, that do lots of cutting edge research to make sure that their product, their tool, is the best possible quality. There are many others that reach the minimum standard of the FDA, that it can be put in a person's mouth, but is that company going to be around in 5 years or 10 years? What if you get an implant like that and in 3, 4, 5 years, that implant company is out of business and they can no longer find kind of the parts and pieces that they might need to access that tool, to give use for that tool? Because I want my patients to be able to feel confident that after I'm long retired, that their dental implants will have a company supporting them that can provide all the parts and pieces and different access that might be necessary to use your dental implant that you paid your good money for. So the dental implants is one component, as I mentioned. Aesthetics is another component to a dental implant. So on top of a dental implant is a crown, and that crown can be made of lots of different things. There's emax, there's porcelain, there's different ceramics of all kinds, there's zirconia that can be used to reconstruct your mouth. The materials that might be chosen vary widely in terms of how aesthetic they look, how natural they look, and also how they perform over time. All these things come into play to make your decision honestly more challenging, which is why it really takes trust between a patient and a doctor to get to the solution that you're looking for. Again, we're talking about tools. We're talking about this shovel versus this shovel. They're both shovels, but they might do different things. That's why it's really important to establish a relationship with a doctor that you feel comfortable with. So when it comes to turnaround time, you can have an immediate implant, meaning a tooth is removed and an implant is placed at the same time, or you can have a tooth removed and a bone graft done, waiting a period of time, and then an implant placed and then waiting another period of time, and then a tooth going on top. You might get teeth the very same day that the implant is placed, and you might get teeth like 9 or 12 months later. Dramatic differences in timeline depending on the solution that you're really looking for. So the resources that the dentist that you go to also has a big contributor to cost. So is this a place where you have everything under one roof, meaning, like, I'll give my offices as an example. I'm a surgeon, so a surgeon obviously does surgery. I put the implants in, I do the bone grafting, I do tissue grafting. And my prosthodontist, as the name probably rings a bell for you, a prosthetic, they do the teeth. And the third part of that is an in-house lab. A lab is the other really critical component to this. And the lab has a huge expense, and that expense can be controlled when that lab is in-house. When your doctor controls all aspects of that cost, they can bring the cost down for you very often. By far the most expensive dental implant treatment is the treatment that you need to redo. Redoing the treatment again almost always leads to increase in need for reconstruction. The question that should be coming up is, if I pay very little for the surgery, for the implant, am I going to be paying again when that implant fails, and what is that cost going to be? What kind of structure, function, and biology do I need to reconstruct at that point? I would caution you with going with the cheapest provider. If you find treatment that is very, very cheap, it is probably for a reason. Again, I don't want to project on a low-cost provider, but you get what you pay for. The number one currency that I have with my patients is trust. Trust is by far the most important thing that you can have with your provider to make sure that you're getting the solution that you're looking for. Getting dental implants is not a decision that you should rush. So I want you to be armed with the questions that you need to have, and also the knowledge that you need to have before you go in for that consultation or before you accept a treatment plan. So click the link below. It's going to give you a resource that will enable you, empower you to be able to make the right decision for yourself. If you want to see what happens when shortcuts and cheap prices and even robots collide, watch the video that we've got above.